Turning to our COVID-19 coverage now. Back on Monday, we opened the week with a startling headline. The number of new daily coronavirus cases in Ontario had shot past the 300 mark. Well, here we are on Friday, just a few days later. That number has now gone above 400. 401 new infections are being confirmed. That's a sharp increase from where we opened the week at 313. You need to go all the way back to late May and early June to find daily caseloads in the 400s. No additional deaths are being reported today. So where are the new cases coming from? 71% of them are right here in the GTHA, led by Toronto with 130, Peel with 82, and York Region with 40. There's another major contributor that you do not see on this map. Ottawa is reporting 61 additional infections. Ontario's rolling five-day average is now 315. That's up from 181 a week ago. Hospitalizations remain stable, and that's mostly due to the fact 67% of the new patients are under the age of 40. Just under 36,000 tests were processed yesterday, a new record for the province's labs. But more than 40,000 tests remain under investigation. That is the biggest backlog we have seen so far. And Premier Doug Ford was in Ottawa today. He called today's jump a big concern.
We've seen the system go from under 100 cases, literally overnight, up to over 400. It's very concerning.
Ottawa's medical officer of health today said the city is in a second wave and warned they can't sustain a rapid rise in cases. Epidemiologist Colin Furness says it's hard to pinpoint exactly when a second wave begins, but that this uptick started 5 days after Labor Day.
I think what we're seeing is the butcher's bill for having loosened restrictions for 3 months in a row, and hot weather helped us a lot. But then came the Labor Day weekend. It was a bit cooler. Everyone seems to be having house parties and hanging out and doing things they shouldn't do. And so there's the consequence for that. I think the second wave is going to happen. I'm going to call it for the end of October. I think we're going to see a spike from Halloween.
There was another day of long lineups at assessment centers, showing the strain on the system and those who had to wait.
We knew for 6 months that the second wave was coming. We knew that the schools and the universities were going to open, and that was going to increase the rates. And there just seems to have been zero planning for it.
This Ottawa father went at 6:30 this morning to hold a spot for his toddler to be tested. He waited 7 hours.
There were some families where the kids were here. It wasn't just parents holding the line. And, you know, these kids, they had a bad cough. They were sneezing. They were moaning from their little bodies aching.
The Premier says mobile assessment units are being sent to hotspots, and testing for asymptomatic people should be up and running in pharmacies, hopefully by this time next week. He's still encouraging those without symptoms to be tested. Alberta has changed its policy, prioritizing those with symptoms, while BC yesterday announced a new saliva test for children instead of nasal swabs.
Is Ontario behind when it comes to starting up new methods of testing? Are there better methods that we should be exploring?
I saw that as well, and as I always say, I was onto it like an 800-pound gorilla. As soon as I heard that had been onto it about the saliva testing, making sure that we have approvals from our health team, but also the federal folks at Health Canada, making sure everything is fine. As soon as I saw that, I went right to our team. I think it's great for everyone, and it makes it a lot easier than getting the swab up the nose.
Epidemiologist Colin Furness says the advantage of saliva testing is a trained healthcare professional isn't required to perform it, unlike nasal testing.
As usual, BC is way ahead of us, and they're providing a great example that I really hope we follow.
As of today, Toronto, Peel and Ottawa are under tightened restrictions that lower the size of public gatherings to 10 people indoors, 25 outdoors. Premier Ford said this afternoon those increased restrictions could be added to more regions. Markham's Mayor Frank Scarpitti has asked for them to be extended to York Region, and health officials from London, Ontario, where 39 cases have broken out at Western University, are also requesting the tougher measures.